whether the patient is having the Cushing syndrome due to the adrenal adenoma or pituitary adenoma or some paraneoplastic feature, right? So very quickly what we'll do, after diagnosing this, now we'll go for the localization test. We call it localization test. Now we very quickly are going to do the test for the ACTH, right? So we will look for which one? ACTH. All of you try to understand this thing. Now we are going for the ACTH. All of you tell me the answer. If somebody is having Cushing disease, not the syndrome, disease, it means where is the pathology? Pituitary. So is the ACTH high or less? High. So if you tested the ACTH and you found that ACTH is high, right? If the ACTH is high, it means the patient is going to, one of the cause could be the pituitary adenoma, right? You tell me, if the patient is having adrenal adenoma independent to ACTH, so this patient will be having high ACTH or low ACTH? Low ACTH. So you found that ACTH is low and you have made your diagnosis. Patient is having the adrenal pathology. Right? What is the patient having? What is causing the Cushing syndrome for him? Adrenal pathology. If the ACTH is low, patient is having the adrenal pathology. But if it is high, now again two things can happen. Whether it is the pituitary adenoma or it is simply the ectopic paraneoplastic ACTH. Or if you are getting the idea. So now if it is low, we have got our diagnosis. What is that? Adrenal pathology. And once as soon as you find the patient having adrenal pathology, then you need to find out that what the patient is having. Whether there is bilateral hyperplasia or the adrenal adenoma or the adrenal carcinoma. So you are simply going to do the CT scan, right? So imaging system will be done, CT, MRI will be done for this patient, and we'll try to see that what is the situation of the adrenal gland. Okay, but now if it is high, if the ACTH is high, again we have got some lafra. It could be pituitary adenoma or it could be which one? The ectopic paraneoplastic ACTH. Right, so it could be any of this. So now what should we do? If this situation happened, if it is high, then again we have got two different jobs to do. We can do the testing by two different methods. Try to imagine this thing, all of you. One testing, we simply call it the CRH stimulation test. Right, what do you call it? CRH stimulation test. Tell me, CRH is produced by which one? CRH, the corticotropic releasing hormone, is produced by the hypothalamus. And in response to the CRH, the pituitary gland is going to produce the ACTH. Right? So this test we are going to call it CRH stimulation test. Imagine this thing, that this patient came to you, now the ACTH is high, and you need to find out whether it's the pituitary adenoma or the ectopic paraneoplastic feature. So one of the methods I told you, we can do the CRH stimulation test. And in this test, we can simply check, once we will give the CRH, you tell me, all of you try to imagine this thing, if we give the CRH to the person, if we give the CRH to a person, and if there is pituitary adenoma, and if there is more CRH, then the ACTH is going to be increased or not? Right? And if the patient is not having the pituitary problem, somebody here, some ectopic problem, which is producing the ACTH, is that ectopic disease, for example, a small cell lung cancer, is it going to depend upon the CRH or not? No. So ectopic paraneoplastic does not depend upon the CRH, but the pituitary adenoma depends upon CRH. Are you able to understand this thing or not? Okay, so never forget, if the increase will happen, right? If the increase is going to happen in the ACTH, it means the patient is having adrenal adenoma. So if there will be increase in ACTH, whatever amount was there, this amount increased. If there was the increase in ACTH, and if let's say there was no increase in ACTH, no increase in ACTH, then two different things we are going to think about. Number one, we are going to think that if there is increase in ACTH, it means patient is having which pathology? Tell me which pathology patient is having? Pituitary adenoma. And as soon as you make your diagnosis, now you need to confirm your diagnosis. So to confirm your diagnosis, we are going to do few tests here, right? So as soon as we think about the pituitary adenoma, this is not the confirmatory diagnosis. We have got the idea, maybe the patient is having pituitary adenoma. Now we need to confirm the pituitary adenoma. So how to confirm the pituitary adenoma is by doing the MRI of the brain, right? We will do the MRI, we will try to see the size of pituitary. If the size of pituitary is larger, then we say, okay, patient is having pituitary adenoma. But suppose the size of pituitary is not that large, you could not find any mass. Still there is a chance that patient is having pituitary adenoma, which is not very big, which cannot be seen in the imaging, and for that we do one sampling and we call it inferior petrosal. All of you know there is a petrosal sinus in the your temporal bone area. All of you know this thing, isn't it? So in this inferior petrosal sinus sampling. So what we are going to do, we will take the sample from the blood from the inferior petrosal sinus, and then we'll check the amount of CRH and amount of ACTH. If the ACTH is high in this sinus, it means okay, this is being produced by the pituitary gland. But if the amount became normal, then maybe the patient is not having the pituitary adenoma, right? So in this way we can diagnose the pituitary adenoma. But if there was no increase in the ACTH, it means the patient is having which kind of cause? He is having the ectopic paraneoplastic ACTH, and here our job increases. By the way, I have already told you there are three very common paraneoplastic ectopic causing ACTH causing cancers in our body. What are those? A small cell carcinoma, so you will do the CT scan of the lungs. What is the second one? Bronchial carcinoma, so again the CT scan of the lung will help you. And what is the third one? The thyroid medullary, so maybe we need to even test the thyroid gland, right? So we will even rule out the common pathology here. So all of you try to imagine, when the ACTH was high, we did one test, we simply called it the CRH stimulation test, and then we could find if it is increasing the ACTH, then we found a patient having pituitary adenoma. If it is not increased, then we said that a patient is having the ectopic paraneoplastic ACTH. Now at the same time, as I was saying, that we can even do another test for this patient, and this test is not the CRH stimulation test, we call it high dose. By the way, if I am saying high dose dexamethasone test, it means how much dexamethasone I am using? 8 milligrams. 8 milligram. So we are now going to use the 8 milligram high dose dexamethasone test, right? And in this test, it has a very simple thing. When we give the low dose, and if there is pituitary adenoma, it will not be suppressed. But if the patient is having high dose dexamethasone, if we increase the dexamethasone, and if it is the pituitary adenoma, then it is going to be suppressed. So remember, pituitary adenoma, the Cushing disease, does not get suppressed by the low dose dexamethasone, but it gets suppressed by which one? High dose. So now suppose that you have given the high dose and you found the cortisol got suppressed. So let's say that cortisol, let's first say not suppressed. Cortisol did not get suppressed. If the cortisol did not get suppressed, your diagnosis is very simple. It means the patient is having which disease? Ectopic paraneoplastic ACTH. But suppose it got suppressed, cortisol got suppressed. Cortisol got suppressed. Then it simply says that patient is having which disease? Pituitary adenoma. Right. So two methods, how can we localize the disease, whether it is the pituitary problem or whether it is the adrenal problem, is by doing these two tests. Either the CRH stimulation test or by the high dose dexamethasone test. So you people need to be very careful and very clear about this understanding, that what is the difference between the low dose and the high dose. So is this graph clear to all of you? Okay, so let me just revise once again, that will be more clear. You imagine, all of you don't look here, you imagine this thing. A patient came to you and he is having all the features of Cushing syndrome. It means it increased your suspicion. So now once you got suspected about this disease, you need to do the diagnosis. How many methods are there to make the diagnosis? 3 methods. What is the best method? So you did the 24-hour cortisol testing, urinary cortisol testing, and you found it is not increased. Can it be the Cushing syndrome? No. But if you found that it is increased, then it means it is the Cushing syndrome. But we don't know which kind of Cushing syndrome. We know that it is diagnosed of the Cushing syndrome. Another method was the low dose dexamethasone suppression test. You gave the 1 milligram of dexamethasone and the cortisol decreased. Right? So can we say that patient is having Cushing syndrome? No, it is ruling out the Cushing syndrome. But it did not suppress it, it means patient is having Cushing syndrome. Now the patient is having Cushing syndrome, again we need to go further. We have got two methods to do here. We are going to check for the ACTH, and if the ACTH is low, right? If the ACTH is low, it simply means the patient is having which pathology? Adrenal pathology. And if ACTH is high, then it's going to be having which pathology? Okay, if it is high, it could be the pituitary pathology or it could be the adrenal pathology, right? And how to know that? By two methods. One is called as the CRS stimulation test, and what's the other one? High dose dexamethasone test. Clear what I'm saying? And we already learned that in the case of the CRS stimulation test, if there is increase in ACTH, it means it is the pituitary adenoma. If there is decrease in or no increase in ACTH, it means the patient is having ectopic paraneoplastic ACTH. But at the same time, when we look at the high dose dexamethasone test, if it is 8 milligram, then if the cortisol is not suppressed, then it means it is the ectopic paraneoplastic ACTH. But if the cortisol is going to be suppressed, then it means patient is having the pituitary adenoma. Clear what I'm saying? Okay, so this is about the testing or diagnosing the Cushing syndrome. Now the question is how to treat this disease, right? My question to you, what is the most common cause of Cushing syndrome? Exogenous. So how to treat the exogenous Cushing syndrome? Stop it. Now tell me, after the exogenous, in case of the endogenous, which is the most common cause of endogenous Cushing syndrome? Pituitary adenoma, right? So how to treat the pituitary adenoma? Tell me. The best method is to do the transsphenoidal surgery. So we remove the pituitary gland, right? And if we cannot remove the pituitary gland, we can give some drugs in order to suppress the amount of pituitary production. So let's do one thing. Let's write these things down. We'll try to understand this thing. And Ruel, just pause for a minute.